Welcome to Case Closed, a video series that explores real TMLT medical malpractice cases. My name is Anthony Stokes, and I'm a claims supervisor at TMLT. The following case illustrates how action or inaction taken by the physician led to allegations of professional liability. In this video, risk management techniques will also be discussed that could have prevented the outcome or increased the physician's defense. A 60-year-old man called his primary care physician to report that he had twisted his ankle and was in great pain. He requested a prescription for pain medication. The patient had a history of lupus, hypertension, rheumatoid arthritis, chronic anemia, and kidney disease. He also had allergies to naproxen, codeine, penicillin, and diphenhydramine. His medications included prednisone. The physician was moving to a new office and did not have access to the patient's chart. He called them prescriptions for naproxen and tramadol. The physician did not see the patient or document any discussions of medication allergies. The patient called the pharmacy to ensure they had received the new prescriptions. He typically referred to naproxen, a medication he was allergic to, by its brand name. He asked the pharmacist if the new prescriptions were safe to take. The pharmacist told him the medications were okay, but if he had any reactions, to stop taking them. 2 days later, the patient was taken by ambulance to a local hospital for an allergic anaphylactic reaction. The patient was in severe pain and had skin eruptions on his right arm, chest, and pelvis. He told the ED physician that he had taken the naproxen and tramadol, but thought the tramadol caused the rash, so he stopped taking it. He continued the naproxen, which worsened his condition. The patient was admitted and diagnosed with Stevens-Johnson syndrome. The patient was in the hospital for 14 days and experienced significant skin blistering over 20% of his body. A lawsuit was filed against the primary care physician and the pharmacy. Allegations included improperly prescribing naproxen to a patient with a known allergy to the drug. It was further alleged the prescription caused the patient to develop Stevens-Johnson syndrome, to be hospitalized for 2 weeks, and permanent scarring. TMLT consultants who reviewed the case were critical of the physician for poor documentation. The physician was also criticized for prescribing naproxen to a patient with renal insufficiency, as these patients are at higher risk for worsening kidney disease when taking a nonsteroidal anti-inflammatory drug. A plaintiff consultant stated the physician breached the standard of care by neglecting to check the patient's drug allergies. Had the physician paid more attention to documentation on the patient's history, the patient's adverse drug reaction and Stevens-Johnson syndrome may have been prevented. All consultants were critical of the pharmacist for failing to check the patient's drug allergies and for telling him naproxen was safe to take. The case was settled on behalf of the physician. The pharmacy also settled with the patient.
Hello, my name is Robin DeRocher, and I'm a manager in the Risk Management Department at TMLT. Medication errors can occur when prescribing a drug, entering drug information into a computer system, preparing or dispensing medication, or when the drug is given to or taken by a patient. Documentation was a weakness in this case. To avoid prescribing errors, review and update current medications and medication allergies at every patient encounter, including phone consultations. Clearly document and date in the record when a patient reports an allergy, develops an adverse reaction to a medication, and reports not being allergic to a medication. Allergy information left blank in the record may not indicate the patient is allergy-free. Also, if a patient is inconsistent in reporting a drug allergy, consider prescribing an alternate medication. Patients often don't know the generic names of drugs. This case presented an opportunity for the physician to educate the patient about his medications. A good strategy for patient education includes providing written and oral descriptions of prescriptions, including generic names, interactions, side effects, dosages, and proper administration. More closed claim studies are available at tmlt.org. All studies have been modified to protect the privacy of the physician and the patient. Thank you for watching.